Okay, we are back, and now we're going to talk about giving a nebulizer to an infant who is on oxygen. All right, so really I say that, but there really is no difference in how you give a nebulizer to anybody if they're on or off oxygen. The main point I want you to take away is that you're not going to remove the oxygen to give a nebulizer, okay? So right now we have Ashley's baby here who is on a nasal cannula, and the back of it is at the back of her head so that it's not underneath her neck. And so this is how you will see it in the sim lab as well when your infant patient is on a nasal cannula. Right now the baby is connected, and you know, I always tell people make sure that you're checking the integrity of your equipment. So if your patient is cyanotic or their pulse ox, their SpO2 is low, and you can see that the cannula is in their nose, and you see that this is hooked up, make sure that your flow meter is on. Make sure that there's a silver ball that is floating at the prescribed liters. And in this situation, the middle of my ball is right on the 2-liter mark. So that means that the infant is getting 2 liters. I'm also going to check my O2 tubing and make sure that I don't have any little sounds or hissing sounds. Make sure that it's going. You can also just check to see if it's coming out of the prongs, and make sure nothing has clogged it or occluded it. And then in some situations, I forgot to say this earlier, but if your patient has extension tubing, like sometimes there is a connector between what is on the patient's face and what is hooked up to the flow meter, make sure that that is together all the way, because it may look like your patient is getting the oxygen here and getting the oxygen here, but then there's a split in that connectors of the 2 tubes, and that can happen a lot actually. So always check that as well. Now we're going to talk about giving a nebulizer to an infant. And so in this situation, when we're trying to figure out how we're going to do that, this mouthpiece would not be appropriate to do because the baby cannot keep a seal on the mouthpiece. I mean, it's not going to stay in the mouth. They're not going to breathe in and do a breath hold properly for this to work. Okay, so the next thing you might be thinking is maybe a mask. Okay, this is an adult mask. We do have infant masks. I couldn't find it, but we do have infant masks. We do have pediatric masks. And in some situations, the pediatric patients, usually like your 4 to like 9-year-olds, they have specialized masks that look like little dinosaurs or polar bears or something like that. And they would connect just like a normal mask would connect to the nebulizer cup. And you would instruct to the patient, to the child, the same way you would, but in a terminology for a child to understand. And so in that situation, a mask is okay if the patient is going to tolerate it. But let's say we have a situation where the mask is not appropriate. So I'm going to ask Ashley some questions about her baby, and that's going to help me determine if a mask is appropriate to put on this infant. So Ashley, can you tell me what's been going on with the baby?
Yeah, she's been coughing and really phlegmy, and she's been vomiting.
Okay, all right. So in this situation, we wouldn't want to apply a mask because we want to be able to get rid of the mucus that the baby may cough up, or help get rid of the emesis that the baby is going to vomit up. So putting a mask on could alter or inhibit us from getting into the mouth and clearing the secretions in the vomit. And in that situation, that's going to become a safety concern for the baby to aspirate. Also, we're going to be interrupting the nebulizer administration over and over by sucking the baby out nonstop with a bulb syringe in the situation that we use a mask. So a mask would not be appropriate in this situation for an infant. Also, let's say this baby was 1, 2, or 3, and we try to use a mask because we think that the child could possibly understand the importance of using this mask. But if the child is going to protest you because this looks scary, and anybody in the medical field that comes at a child with any piece of equipment is going to look like it's going to hurt them. they're going to be scared of you. They're going to thrash. They're going to try to tear it off. And you're going to have an interrupted nebulizer that's not going to be therapeutic at all, and they're not going to get the medication. So there are other ways to ease the child into this. And for this reason, I'm actually going to put meds in here just to show you what it does. And I'm going to show you, this is not a mechanical simulator. This is just a baby doll. So I'm not going to cause any damage to this by putting the nebulizer in front of a simulator. But I do want to tell you that in sim, again, as a reminder, we will never put meds in the cup during your scenario. But for this situation, I want to show you something. So when you're going to give a medication to an infant or to a patient who cannot hold the mouthpiece and cannot wear a mask, we do what's called a blow-by. And to do a blow-by, you are going to take off the mouthpiece and you're going to stick on this fancy glove. And then you're going to connect it back like this. So now what we've done is we have just one exit point for the mist to come out of, all right? So I'm going to set this down for a second, and for the purpose of showing you what the nebulizer does and sounds like, I am going to pour, I did my med checks, and I'm going to put the med in here just like that. I put it in the hole. I did not have to take off the top, all right? My tube is already connected to air because we're always going to give the breathing treatments with air. And then I'm going to connect the mouthpiece, the T, okay? So now I have my liquid in here. I have my mouthpiece is closed off, and I have this tubing here. And now I'm going to explain to Mom again what I'm going to do. Okay, Mom, so what I have in here is albuterol, and this medication is a bronchodilator. So it is meant to open the airways, the bronchioles, which is just a big term for the tubes that go into each of our lungs. And the way it does that is it dilates it. It's a bronchodilator, which means it's just going to open up the baby's airways so that she can take a deeper breath. And sometimes when this occurs, when we're giving the breathing treatment, sometimes you'll see the pulse ox may look like it's going to drop for a second. That's normal. It's a mechanism of the medication, but it will come back up, and sometimes it can make the heart rate go higher. That is a side effect. We'll be watching baby to make sure. Just as a reminder, baby's heart rates are a little bit higher anyways, but we're going to watch it. I'm going to be right here with her. I'm not going to leave her. So if you want, I can hold it, or if you feel comfortable, you can hold it in front of the baby. What's going to happen is I'm going to turn this on, and the medicine is going to nebulize through, and a mist is going to come out. And so I need you to hold this upright, and I'll show you what happens if you tilt it. And then we're just going to hold it in front of baby. And in a situation of like a child, like 1, 2, 3, I'm going to turn this on so that you can see what a child may think when they see this. So I've connected it to air on 8 is great, and right now we see that mist coming out. Now, if Ashley's baby was a little bit older, she might be looking at this and saying, hot, ow, owie. They might think that this is heat because it looks like smoke. So we've sort of taught our children that if you see smoke, it could be hot, and they're going to think that's hot. So they may be afraid of it. So something I usually do with parents is I'll say, all right, Susie, this is not hurt, it's not hot, it's cold, you want to put your hand here, look, it doesn't hurt. And so then I might say, look it, Mom is going to breathe in a little bit, and no owies, it doesn't hurt. Now Mom, if I go like this, then you'll hear that sound. It stops, which means the medication is not nebulizing. So we have to have it upright so that the medication will come out. So Mom, I need you to hold this in front of your baby's face. Yep, and if you have to help your patients by repositioning the baby, you just want to make sure that it's up. And the mom or whoever can hold the nebulizer in front of the baby for the entirety of the treatment. And at this time, we're basically listening. If baby coughs, we can get to the mouth and the nasal passages really fast. We can use a bulb syringe to get it out. Sometimes I might tell mom, go ahead and shake it a little bit so that some of the bubbles might get stuck on the sides of the cup. For the purpose of this video, I only put half of the liquid in there so that I could have you listen to what it sounds like when it nebulizes all the way. So I'm going to stop talking here for a second. So when you don't hear it making that little spurt noise, that means that your neb is done. Okay, so sometimes I shake it a little bit to make sure I get it all. Okay, and nothing's coming out of it. So in this situation, our time is up, or the medication is gone and we've nebulized the medication. So then I will take the cup from the parent and then I will turn it off. All right. Then you would reassess your patient as you would normally do. And typically there is a bag. So we have patient belonging bags, or you may see like a bag like this, or you may see like a respiratory patient belongings bag that is hanging on one of the flow meters. And typically the nebulizer kit setup is inside there for the patient. When you get done, usually we like to air dry this. We'll rinse it out with some water and then stick it on a paper towel to let it dry out. Sometimes you might see RT comes and goes and gives the breathing treatments. When they get done, they empty the rest of the fluid and then they stick it in the bag apart so that it has time to dry out, so it's not just sitting in there. That is typically how we will give a blow-by to a infant or small child who cannot use a mouthpiece and who cannot wear a mask.
That's good.